and Alabama Workers' Compensation Organization conferences, taught AMA impairment rating courses, and has been published in the Journal of Acute Care Physical Therapy. Welcome, Enoch. And the last but not least, Jessica Adams. Jessica grew up in Montgomery and she attended Troy State University, where she earned a bachelor's degree in print journalism with a public relations contract from the Hall of School of Journalism in 2003. Following graduation, she worked in property management for several years before changing her career path and transitioning into the field of workers' compensation. From 2010 to 2014, she worked for an orthopedic group as a workers' compensation coordinator. She has been a workers' compensation claims adjuster in the construction industry since 2014. She is currently working at Construction Claims Management, handling claims for Alabama Home Builders Self-Insured Fund. In 2016, Jessica joined the AWCO board as second vice president. She has also served as first vice president for 2 years and was the president in 2019 and 2020. In 2021, she served as a board member, and she is also an active member of Montgomery Claims. Welcome, Jessica.
Well, thank y'all for joining us for this last session. I know we will get y'all out of here on time or early because Jessica and I talk real fast when we get nervous. Enoch is the cool cucumber in the middle, so he's gonna keep Jessica and I, straight. But I do thank y'all both for doing this with me. We got the topic of catastrophic injuries. And it's such a broad topic, we really didn't know what direction to go with it because there's so many avenues you can go and so many facets of it. But we're going to do our best to hit a few highlights and have more of a question and answer discussion kind of thing among the panel. I did do a few. Slides. They may not be going. But anyway, we did a few things. We had a few objectives. We wanted to review the definitions, types, and claims cost of catastrophic injuries. We were going to discuss some challenging aspects that we all face in catastrophic injuries, and then discuss some strategies of kind of how we mitigate some of those amongst ourselves in our own professions. So the first thing we wanted to talk about, I'm going to ask each of you, Enoch, what do you think of when you think of a catastrophic injury?
So from our standpoint in therapy, I think the biggest thing that comes to mind is something that's drastically life-changing in a functional way. So something that's going to prevent or drastically change how they go about their normal daily life, their work life. So from a physical standpoint. So I think for me, that's what it means.
How about you, Jessica?
I think more along the lines of, the types of injury, loss of limbs, spinal cord injuries, traumatic brain injuries, severe burns, blindness, things like that. I think more of a mechanism of injury kind of thing.
And I do too. I go along those lines. I didn't find like a just specific definition for catastrophic injuries, but I looked up catastrophic just as a definition of itself, and it was involving and causing a sudden great damage or suffering. And then an injury was defined in the dictionary as hurt, damage, or loss sustained. So those two together, so it would be a great loss or a great injury that's sustained by an employee. I found the AMA definition somewhere along the way, and it is a severe injury to spinal cord, spine, or brain. So they limit it to that, which I thought was unusual. And then I did a Google search and came up with most things that popped up were attorneys' websites. With, have you had this?
That too.
But they were all in the same vein of what we are thinking. A lot of them were, it's often identified by its anticipated outcome, extremely or particularly serious illness that or injury that can cause permanent disability, a severe change in the way a person injured or lives or works. It can be fatal, it doesn't have to be, but it can be permanent impairment. And it doesn't always have to be, there's going to be some permanent impairment, but they could go back to work, but it's still going to be a life-changing, I think, type of, and their families have to do, change the way they do things as well. But I think we could all agree that they are complex, expensive, and can be very unpredictable at times. So I thought it unique, or not unique, or just unusual that there wasn't just a good, solid definition. It's kind of everybody's interpretation.
And I'm sure most of you guys actually see a lot of those, whether it's the TBIs, the amputees, those are the kind of ones that come to mind. Spinal cord injuries, burns, those are the ones that are going to have those long recoveries, going to have usually permanent damage or disabilities. They're going to be able to work or function a lot of times the same way that they were before. So it's definitely going to have a great effect on their work life and their personal life.
Yeah. And that's a lead into our next kind of question was we were thinking about examples of catastrophic injuries. So I know we mentioned TBI, spinal cord burns. Are there any others? I had a couple others or any others. you got?
Organ, if they've got severe internal injuries, organ, damage, things like that as well.
Yeah, a lot of times amputations, multiple bone fractures,
Multiple
like somebody that's had a crushing injury with a pelvic fracture and femur fractures and
Non-weight bearing on both,
and then
extremities.
it ties into the organ,
Mhm.
with all or abdominal injuries, ties all that in. So that was one of the other examples we had. And then, we were thinking about what are the causes, what types of injuries cause these types of injuries? So Jessica, what comes to mind on a few of, top
Obviously
ones of
on
your
my,
list?
what I'm used to, construction injuries, tractor accidents, things like that, trees falling on employees, motor vehicle accidents, a lot of that type of thing.
Yeah, I say the same thing. We see a lot of like the MVA accident, the motor vehicle accidents are huge. Industrial accidents seem to be pretty catastrophic sometimes. I think in the therapy world, those are probably two of the most common ones that we see are industrial accidents and then the car accidents that they're in.
Yeah, and I think personally, I've seen falls from heights. I've had a couple paraplegics
Yeah.
with falls from heights that have had burst fractures to their
Mhm.
vertebrae. They end up paraplegics. I had one case that was ended up being an amputation, but it was caused from electrocution. The guy was a concrete finisher. They had these long poles that they use, I guess, to finish the concrete, and somehow it struck something that was live electrically behind it. And he had some other injuries as well because it traveled all the way in and out his foot, and then he ended up with a below the knee amputation. So all of those working, I think, with equipment and burns and all those kinds of things are also acts of crime in our world as it is, being a little more violent these days. We've had some shootings. I know many, many years ago now, it feels like there was a shooting at UAH. A employee shot some others in a meeting. But I know some of my case managers took care of some of those folks and they were catastrophic. I know the man that we took care of had all kinds of disciplines and he had fractures, he had eye injuries, he had all kinds of injuries that we had to deal with. So that's another. something to
Yeah,
keep in mind.
we saw one. I remember one time we had a gentleman who was at a crime as well. He was working away from home. He traveled and he was attacked and beaten really bad. And so he sustained a lot of injuries, barely lived, but it was the same thing. It was a severe beating, but it was a crime that took place. They robbed him. So.
Mhm. Another thing we want to think about is what types of employment, what types of work do people do? Now, catastrophic can happen anywhere, but there are some that we've seen over the years we've done this that happen more often or more at
Higher
risk
risk.
for.
Mhm.
Yeah. What have you seen, Jessica? What, I know you.
Yeah, like obviously construction, we've got forestry on there. I think forestry probably is the number one, if I had to guess. Manufacturing, obviously truckers, that's kind of the main ones in my mind.
What employers have you seen? Types of work have you seen?
I mean, most of the ones that come to mind are generally industrial type jobs that involve using machinery of some sort, or work that requires them to drive a lot on the highways, and whether it's a truck driver or just some sort of transportation type industry, but and they're involved in an accident, whether it's them or someone hits them or whatever. And so those are probably the two that come to mind the most, are the industrial and that.
Yeah, and I think as case managers, that's pretty much what we've seen too, construction and manufacturing. I've seen some like emergency response, EMS, police, firefighter type things. They are prone to have. I only got one more. No worries. But yeah, that's where I've seen a lot of them too. And I think I looked on one of the other things I noticed in just an internet search of employment type things is mining. And I think we still have a fair amount of mining in Alabama, don't we? So some of those injuries would be big too. The last thing we kind of looked at as far as like demographics, I guess, of catastrophic injury would be cost. It was hard to dig up cost. But we had a couple that were live cases that we've had in the past, and I've gone back to adjusters that I've had. I've had one close for a long time, but it's a paraplegic, and he still has treatment periodically to this day and maintenance and things like that. And so I went and asked the claims adjusters and stuff that had that one. And it was from 2010. And to date, they've spent about $1 million on that claim with everything. So they came in, that was my paraplegic guy, and he did great. I mean, he went back to work. He owned his construction business and of course had to work different, but it was a great outcome for such a bad injury. But it's still $1 million. I looked up serious burns, and there was some with the NCCI data. I noticed in their threshold for large burns, large loss burns is about 500,000. So anything that would be over 500,000 would be expensive on the burn side and considered like catastrophic. I know you've had one, Jessica. What have you?
All of these are, that came from me. We've got, I'm currently got one that's a TBI. He's, his reserves are right at, are paid to date at right at 1.6 million. Still treating, not at MMI yet, so that's going to be high. We had another one from 2019. He had multiple injuries. He was in a coma for 2 years before passing away. We're already at 3.6 million on that one, which that actually reached the retention layer. So reinsurance is involved now in that one. So they can get pretty high.
Yeah. And I think that was just to kind of show what type of cost range we're looking at these catastrophic claims, that they can be very expensive. And then someone mentioned earlier in one of the other talks that we were talking about cost a little bit, but with the advancements in medical care, it's so advanced now and it's expensive as it is, but people are able to survive these catastrophic injuries where years ago they may not have been. So you've got the higher medical costs and advances in medical costs, but then they live longer too. So you've got the maintenance over the years of return doctor's appointments or whatever they need. So
yeah, you think of a lot of the equipment too that's available to them now, whether it's amputees that have a lot of specialized type equipment, even spinal cord injuries, the cost of the chairs and the type of things that are available now is astronomical compared to what it was. I mean, it's great that science has given us a lot of these things, but they do cost a lot of money. So that's another reason I think it goes up a lot, is just because of the medical advances that we have and things that are available to them post injury to still get their daily work done and function in their households. There's a lot of stuff out there, but it's expensive stuff.
Now that's the kind of where I kind of left off with like the demographics of catastrophic, just to get an idea of what kind of cases we're looking at and talking about. And the next kind of set of questions are going to be respective to our roles and how we work with each other and other disciplines, and some strategies and challenges that we face when we work with these catastrophic claims. I know y'all have all probably had some yourselves. And if you have any input, you can add in, just holler. It doesn't, this is very informal. But what are some of the most challenging aspects of a catastrophic injury, that we each deal with? What are some aspects that are challenging, Jessica?
A couple of things come to mind. First of all, how time consuming they can be. When you can work for days on end, just trying to coordinate, find a home inpatient facility, transportation, if they're in a wheelchair, trying to find a facility that'll take them, that can treat them, just so much time can be involved in the beginning of trying to coordinate their care. And then another is, to me, is determining the potential exposure, because it is so vast and open. I mean, will they ever be able to return to work? If they do, in what capacity? All the medical care that would be needed. And then not only that, but you may have someone that's, maybe making progress, gets discharged from a facility, but then has to return because they've had setbacks, so it can just be a lot of yo-yo, a lot of up and down. So to me, I think determining that exposure can be very difficult.
Yeah, and I think for clinicians especially, the challenges it can be very different. A lot of what we have to deal with is the comorbidities that people have. If they've had an injury, but they're morbidly obese or they're diabetic, all these things kind of come into play for us. Depression a lot of times. So their emotional state makes it difficult on the rehab side a lot of times, depending on what kind of emotional state they're in. Their family support system, the ability for them to coordinate if they're getting like speech therapy, occupational therapy, physical therapy, to coordinate all of those in clinics and things. So those are the kind of things that we have to look at and that we have to deal with as clinicians when we're working with them.
And on the case management side, a lot of our challenges come from just coordination of all those activities. Coordination, making sure we're getting the treatment to the adjusters to get approvals and then setting it all up, getting all the coordination, and things change quickly. You kind of think you know how something's going to go, and then, a monkey wrench is thrown in. That's not what the doctor orders, or they have a complication of some sort. A lot of the time these folks start in the hospital, so we're running around gathering all the information, trying to figure out what even happened and what their injuries are to help the adjusters and the clinicians figure out what's going on. Another one that, and we deal with so many disciplines within a claim, it's just, you could have 5 physicians or more on even one case, and you're dealing with all them and their aspects. Another big challenging aspect for us is, and I know the adjusters see it as well, is the families. Especially when they're really critical too, by the time they get to us or we have a case, families are just, a lot of them in the beginning, they're distraught, they don't know what to do, and they find out you're a nurse and they just unload. So managing their aspects and their challenges, as well as the patients, because you kind of take on that whole family, even though you're doing the medical care for the patient. What kinds of things need to go right in a catastrophic claim to have the best outcome for the claimant and the employers involved in this, regardless of what that outcome might be?
I think, trying to put together the best team possible, obviously assigning a case nurse right off the bat to help coordinate that care, and praying to God you get a good provider. Let's all be honest. That can make all the difference in the world. So, to me, I think being able to get, coordinate that as much as, obviously we're limited sometimes, but to be able to coordinate as much as possible and keep control of it as much as possible, to me, I think.
Yeah, for us, definitely compliance is a big factor. It doesn't do any good for them if they're not actually getting there. And a lot of times it could be a transportation issue that's inconsistent. It could be that their mental state is variable with those catastrophic ones. They have days sometimes that they don't want to come. So a lot of it's compliance on our end. For them to get better, they've got to be there. And with a lot of these catastrophic injuries, so thinking of especially the brain injury type ones, you've got a kind of a window that's the best window to treat them in. And so if they drag that out for months and they're not compliant because they're not ready for it, they've kind of lost a lot of the outcome that they could have gotten because they waited too long to really get started. So that's a big one for us, is compliance.
On the case management side, I think, of course, communication is probably going to be one of my biggest things, because we have so many parties to keep, up to date and communicated correctly. And then empathetically listening to what patients need, and listening to what the doctors want to order and why they need to order it. And then being able to communicate that appropriately to the adjuster. Because 9 times out of 10, any adjusters I've ever worked with, if they understand why somebody's needing something, they're fine. I mean, they figure out a way to get it done. Even, in the scope of networks or whatever we need to use, it's usually done. So facilitating that communication, and just knowing your injuries, knowing what your clinical background is, knowing, how you handle injuries, what to expect, can go a long way in getting things right for these folks, and making sure it at least flows and they get the right treatment at the right time. We had somebody, actually, I'm gonna go to this one first and then I'll go back to the other one. But one of my nurses asked, wanted us to kind of comment on whether we thought catastrophic injuries were trending up and down.
Yeah, that's a really good question. So I do a lot of post-offer screens and fit for duties. And I can tell you in the last couple of years, since the workforce has kind of become more difficult to hire, what's happened is a lot of companies are hiring less skilled workers. Okay, so I'm seeing a ton of people that are getting jobs that aren't really skilled or qualified for them because they need a body there. Okay, and then the flip side of that, when I'm seeing them and they're getting hurt and they're coming back for these fit for duties, a lot of times it's because they didn't get full training either. They wanted them to get to work so quick that they were kind of skipping on the training aspect of it. And so whether that means that it hurt them or they hurt somebody else because they didn't know what they were doing right. So I don't know if they're trending up or down, but I do know what I'm seeing on that end. And if they are trending up, that would be why in the last couple of years, I would think that could be a reason.
Yeah.
You got anything to add, Jessica? on that?
Not really, I think on our end, it's, as far as construction goes, I think it's just depending on how busy, we all just saw the huge housing boom. You couldn't get a house built for, a year and a half. That sort of thing. So obviously the busier they are, the more prone to accidents are going to be, but some, MVAs, trucking accidents. Yes, exactly. MVAs, trucking accidents, those are always going to happen year round. There's, that's probably going to be very consistent. So I think.
Yeah, and I don't know if stuff that's in the water or what's going on, but we've had, I know, a handful here lately in the last month that have come in as catastrophic type injuries and been in the hospital and things like that. So it's kind of been, I don't know what it is, but yeah. But I don't know in general if it's going up or not, but we seem to have several of them here lately. I'm going to combine kind of two of these questions. We all work with a ton of specialties in between. And I know that we have everything from multiple physicians to all the therapies, PT, OT, speech, even voc type people, voc rehab type people, inpatient rehabs, outpatient rehabs, pharmacies, employers, you name it, home health, rehab, multiple networks, pharmacies. We have so many, and we could all list everybody that just tons of people. But I want to talk just a little bit about who we feel like our main stakeholders are. Now, all those folks are stakeholders, but who is it that we're focusing on as a stakeholder that we work closely with in these cases, and how do we kind of manage their expectations, when a medical outcome might not be known, or we know there's going to be a disability like our head injuries or our paraplegics and things like that. So who are a couple of the stakeholders that we focus on to really work with?
I think families and employers on our end are, families, it's hard to manage their expectations. They want their loved one to go back to the way they were, and that may just not be possible. How do you tell somebody that, and sometimes they have, they're scared. They want somebody to blame, for what happened. And, they sometimes don't have realistic expectations. I listed a couple of examples. We had a young guy that was in a coma, probably always would be. He was on a trach. His elderly grandmother wanted to bring him home and take care of him. And we try, it took us forever to explain to her and to get her to understand that he has to be in a facility. He could ask for you can't take care of him, and, things like that. And so, but she wanted to take care of her baby, she didn't want to hear that. So, that can be hard, and I had another one that was a TBI. And unfortunately, he had some anger issues as a result. And he was, in a physical altercation with his son. Well, they're terrified. They had, cops are called on your dad. That's horrible. They had to, he had to leave for a while, and so things like that, they just, that's so sad and traumatic for them to have to, get used to that new, possibly forever, life changing, so I think, us trying to help them manage those expectations,
I would say also for sure families, a lot of times those are the ones that are bringing them to their rehabs oftentimes. And I've seen it both ways. I've seen families that have way over expectations of they think they're going to return to normal, and they're not going to have any type of permanent disability. They're going to be able to go back to everything the same. But I've also seen the other extreme too, where we had a young man with a spinal cord injury who was a work comp, and his mom was the one bringing him to all of his rehab appointments. And she was very protective, like overly protective of not wanting him to try or do things because she didn't want him to get hurt more or whatnot. So I've seen it both ways with families. So, but in either way, it's difficult to manage on that part. I think it helps with the communication if kind of the physicians and the case manager and the therapist are all kind of on the same page. And so normally with those type cases, where we're seeing like occupational and speech therapy or physical therapy and speech and occupational together, it's good to have coordination between all those disciplines so that we're all kind of on the same page of what the expectations are. So that you don't have one therapist telling them, oh, I think you're going to be able to get and do this, and another one saying, oh, well, you're probably going to have to be, this is going to be permanent. So just having good communication between the physicians too on that part.
Yeah. I think a lot of the areas I run into where they have some unrealistic expectations are, of course, the families and the injured workers. And then sometimes employers, some of the employers I've worked with, and they're not supposed to get it. Catastrophic is not their wheelhouse, and they're not, medical professionals and things like that. And sometimes they have some unrealistic expectations. So you really have to get them on the same page as well, because these patients, these injured workers and families are going to be talking to the nurse case manager, they're going to be talking to the adjuster, they're going to be talking to their therapist, they're going to be talking to their employer rep. So you do kind of, and it hit a good point, you got to kind of get everybody on that same educational page, so they're all speaking the same language to the injured worker and their families. And sometimes that helps ground them a little bit into their expectations. Most adjusters I've worked with get it because they've done it for a long time, and so they can tell too, when someone's not going to have, not going to go back to just their whole regular life, that they're going to have things for long term. So mostly it's the injured workers and families that we really have to work with, and sometimes the employers, when they have to realize that this employee that's been with them for 35 years is not going to come back in the shape and condition that they thought they were in originally. So, let's see. All right. In the interest of time, speaking of kind of employers, what kind of advice can we give employers or even others of how to handle some of these injuries? Because these are even life-changing, I guess, for some of the employers, because they're not used to dealing with it. They don't see it every day. So I'm sure it kind of freaks them out a little bit too. So what is some of our best advice to give them as to how to handle this or how to work with these employees a little bit?
Yeah, like you were saying, first of all, getting their expectations managed to let them know, your employer may or may not return. But I think a big thing we discussed was making sure the employer lets the claimant know that they care. They disappear on them so many times, they don't check up on them. They don't feel valued or appreciated, and so I think that's a big component.
I think you and I had the same thing on that, because I can't tell you how many even non-catastrophic cases I've had where sometimes, and I think a lot of times maybe the employers don't necessarily always know what to do. But yeah, a lot of them have said, nobody called me, nobody talked to me. So I really work with the employers I've worked with. It's okay, call them, check on them. Let them know. And if they ask you something you don't know, refer them back to the adjuster if it's a claim question.
I think sometimes employers are afraid to say anything too.
Right.
They're afraid to call because they know it's bad, and they don't want to, they don't know what, they feel awkward, to approach them about it. So I think a lot of it is just if the employer was, they could be if someone would let them know, hey, it's okay to call them and check on them. Because I do feel like sometimes they're just afraid to call because of the injury, or they feel responsible sometimes too. And so even though it may not be their fault, they feel responsible. So they feel kind of ashamed to call them up and see where they're at and how they're doing and approach them with it.
Yeah. And I think even on the nursing side, sometimes I've called some of mine just to say, hi, how are you doing? Not even on an issue for your claim that I really need to talk to you about or set up in between appointments or whatever. Or, called one of the family members and just said, hey, okay, how are y'all doing? What's going, that kind of thing. Just not having necessarily a reason to call them. I think they appreciate that. I'm skipping around. All right, Enid, we're gonna talk a minute about therapy and stuff for a little bit. Just a second, and then we're gonna round it out at the very end with some strategies, kind of how we kind of can contain these cases a little bit. Couple questions all in one. What are a lot of barriers you see to treating some of the catastrophic injuries? How do you kind of know how frequent and the duration they need to be in, and pulling in other speech OT, all the kind of disciplines that can be in there, and then kind of when to discharge some of these people they're going to be?
Yeah, so I think on the barrier part, one of the main things is to, when you're getting them set up, with their therapy, make sure that where they're going has the tools that they need. So some clinics don't have parallel bars. If you got them a spinal cord or brain injury, you got to have that. Okay. Some of them don't have the adjustable, big, large, high-low type mats. So kind of making sure that the clinics you're using, and I don't know how you guys go about getting those, routed, but making sure that where they're going has got the tools they need. It's great if they've got like the unweighting systems for some of those, or the track systems, or just specialized equipment. So that's one barrier, is not having the right tools to do a good job. Let's see, what else do we have in there?
How do you determine kind of how long they need?
Yeah,
to add other disciplines?
So on the time frame thing, with amputees, there's kind of a waiting period before they can do a whole lot, because you're waiting for healing of that residual limb. But now for something like a brain injury, you've got a short window. That 3 to 6 month window is the best time to actually do the rehab. So you want to move that one really quick into getting, whatever they need, PT, OT, speech, and get them rolling as quick as you can through it, because it's going to start slowing down after 6 months. And by the time you hit a year, you're going to plateau out pretty good. I mean, that's pretty true across the board with any type of brain injury, whether it's, a traumatic brain injury or a stroke. When you get to that year mark, it's very minimal progress you're going to make. It dramatically slows down. So that first 3 to 6 months is really critical. Another barrier that kind of goes along with a lot of these catastrophic injuries that we run into is tolerance levels. And that could be because of comorbidities, if they've got COPD, or if they're obese, if they're diabetic, if they've got, other types of comorbidities that are preventing them from being able to tolerate a lot of therapy. That's also an issue that you run into, especially if they're someone who's going to be getting a lot of disciplines where they need multiple hours of therapy at a time, or throughout the whole week, even their tolerance for it can be an issue. So all those have to come into play when you're thinking about how often they're going to be coming to therapy and how long they're going to be at therapy for. So more often than not, typically, with these catastrophic injuries, they're coming like 3 times a week. Typically, it is probably about right. Especially early on. And then normally you're wanting to be able to tolerate multiple hours because you're trying to get them back. So just, building that up, that tolerance. So it might be that normally they start with PT and OT, or OT and speech, until they can get a little tolerance, or they do shortened PT treatments or OT treatments or whatever it is to get them built up.
And then Jessica, I'm gonna combine kind of the two last ones for you,
Okay.
so we got just a couple minutes. So when you first get a catastrophic claim, how do you kind of assess it, and what's your just quick approach to get things going? And then what strategies do you utilize to contain kind of some claim costs? Because we do have to
Yeah.
think about cost in these. We
Absolutely.
can't just go willy-nilly and do everything.
I think first, again, going back to, I would initially just immediately assign a case manager to get with, coordinate with all the providers to find out what the needs will be, as far as DME, medications, home health, inpatient rehab, anything like that, to try to evaluate the potential exposure. And then also going on to that next question, utilizing your in-network providers. Network pharmacies, vendors, DME, PT, we want to make sure as far as cost containment, using all of those resources to try to keep costs down as much as possible. And going back to employers, we're fortunate in construction, if they need home modifications, a lot of times our fund members will build a ramp or, help them modify their home. So not only is that going back to the showing you care, but you're also cost effective, because obviously they're not going to charge, what they would for a normal home modification for us, so I think a lot of that up front, just trying to contain as much up front, is very crucial.
Yeah, I would agree. And then just from the case management end, to kind of wrap this up, and I do thank y'all. Y'all have no idea how much I thank y'all. To help with this, y'all have no idea. My crew has had to listen to me. But just on the case management end, I think, sometimes we're in the middle of a lot. And so I think for us, communication is key. I mean, it is for everybody, but I think it's a huge piece of our world. And empathetic listening is huge in our world. We know our skills. We know a lot of the medical. We know kind of, you can anticipate kind of what's coming down. Of course, it goes haywire all the time, but I think just keeping everybody on the same page, and remembering that there are people behind these injuries. I know a lot of times we get caught up going, oh, the guy that had the broken hip, or the guy that had the broken leg, or the guy that the tire fell on. You get in that mode and just trying to remember who's who. But I think we really have to remember that there are families behind this. There are people behind this whose lives are changed forever. Ours go on, we go to the next case, but theirs are changed forever. And sometimes they need a lot more time and attention than some of our regular cases. But that's our take on catastrophic claims, and we're done. And I wouldn't say any comments, but it's time to go.
You guys, they're doing the prizes in the next room. Closing remarks, okay? Thank you, guys.
Thank y'all so much. Yeah, I don't think I